So I think the first thing is to understand is that what we learned in medical school wasn't all right. That in the beginning, when I went to medical school, I was taught that the brain was the controller of everything. But now we know that's not true. Now we know that the gut actually changes the brain and changes behavior. Does conventional medicine know this? They absolutely do in the intensive care unit. Patients who have hepatic cirrhosis and hepatic encephalopathy and go into a coma and go unconscious in the ICU, the first thing they do is give them an enema to expel all the feces and decrease the ammonia content produced as the microbial byproducts in the gut. I actually had a family member who was in the ICU with hepatic encephalopathy. He was unconscious, couldn't talk, and within half an hour of an enema, he started talking. But regular medicine never really considers this for other than an intensive care unit. So the gut, in a sense, is like a CNS organ. And this is amazing that the microbial byproducts produce all the neurotransmitters that the human brain uses. And that's amazing. It actually produces half of all the body's dopamine. Half. So, but not all byproducts of the microbiome are helpful. So one of the problems with the microbiome or bacteria is that in a healthy microbiome, lipopolysaccharides stay in the gut, and that's fine. And what's a lipopolysaccharide? It's a lipid attached to a carbohydrate. And there's also disaccharides, which are similar in structure, but they're on top of yeast. Both of these are found in normal benign bacteria, and they are part of the structure and function of a healthy ecosystem of the gut flora. However, if they leak in the gut, it causes inflammation, and it should not release in the gut. So autoimmune encephalomyelitis is the most commonly used animal model to look at multiple sclerosis. Doctors will mimic multiple sclerosis by injecting lipopolysaccharides into mice to cause demyelinations. But they found that actually that the lipopolysaccharides injected into mice not only cause demyelinations for autoimmune encephalomyelitis, but it also causes inflammation in the brain, and it increases beta amyloid plaques for Alzheimer's. How does the gut bacteria affect the brain? Well, we learned that now the microbes in the gut will produce a healthy amount of all the neurotransmitters in the brain. But an unhealthy amount crossing a leaky gut will cause inflammation. Endotoxins, including lipopolysaccharides from gram-negative bacteria, such as Clostridium, or candidiasis with disaccharides, will act as endotoxins onto the brain. There's a variety and whole host of problems it can cause. It can increase histamine. It can also increase tumor necrosis factor, all the cytokines which have been shown to disrupt the blood-brain barrier. Actually, in an MS lesion, when they do a histological analysis, they'll find things such as tumor necrosis factor active in the lesion, plus mast cells. So they'll see a whole host of cytokine release inflammatory byproducts in a demyelination lesion. The other thing which is interesting is that is linked to endotoxins have been linked to activation of the coagulation systems such as increased prothrombin and causes a higher ability for the blood to clot really quickly. MS patients will tend to have more phospholipid antibodies. They not only have antibodies against the myelin sheath, but they have also antibodies against phospholipids. It's a condition called lupus anticoagulant. Now, anything with the word lupus isn't a good thing, but it's found also in MS patients. And they're finding that coagulation is causing like micro levels of like micro strokes in multiple sclerosis, decreasing the oxygen in the brain. So I have lupus anticoagulant. And by the way, lupus anticoagulant is the main cause of young people having heart attacks and strokes. But it's a higher incidence in patients with multiple sclerosis. but even much higher incidence in patients with lupus. So how does the gut bacteria cause inflammation and lesions in the brain? Well, the first thing we have to recognize is that the intestinal barrier is broken somehow, allowing these endotoxins to be released into the GI tract. There's a lot of things which impact the intestinal barrier to be broken. Here's a study done by Dr. Fasano, where he identified these as the major causes of intestinal barriers dysfunction. And basically most of the things found in the industrial food complex, where they're adding glucose instead of sucrose, emulsifiers, organic solvents. Solvents are found in all the food, like when you're buying corn syrup, you're getting agave syrup, or you're eating decaf coffee. All those things need solvents to be able to make it. And those solvents are ingested in the body, and that causes intestinal barrier dysfunction. Gluten, especially when they're just giving gluten by itself to make the bread really doughy. Antibiotics, chronic aspirin and NSAIDs. And microbial transglutaminase is an enzyme used when they're trying to make like burger buns. It makes things sticky and fluffy. It's an enzyme, and nanoparticles. Whenever you see something with the word titanium dioxide, they're using nanoparticles. These nanoparticles are not good for the gut. So when you're looking at multiple sclerosis, one of the things you want to look at is what is this person ingesting, or look at the history. And the other thing which causes a dysfunction in the intestinal barrier is a disruption in the microbiome. So this can be even started as a child. If you had an ear infection when you're 6 years old, you take an antibiotics, it can affect the microbiome. And then when you grow up, that disruption in the microbiome affects the intestinal barrier. Because I've been eating a clean food and clean diet as an adult, but even there's so many factors which you have to look into. So consider this, in autoimmune encephalomyelitis, researchers in MS mimic it by injecting lipopolysaccharides into mice. But this is the most interesting thing, is that they'll give antibiotics to these mice, and not only it decreases the bacterial count in the mice, but it decreases the lesions in the brain of the mice. So we're onto something here. It shows that the bacteria in the gut will have an influence on the brain, and modifying the microbiome will affect the brain. There's many ways of changing the microbiome, but unfortunately, changing the microbiome with probiotics is not as easy as we once thought. We always thought initially that you could just take probiotics and it re-inoculates the gut. There's not much evidence in terms of scientific research that it does restore the gut to a different microbiome, because most of it's broken down when you're orally ingesting it. And the studies show that it's really effective when you're taking it, but not effective when you stop taking it. To restore the gut microbiome might take years and years. You have to look at diet. So the things which will help with a healthy microbiome will be having high amounts of fiber, and all the normal things we learn in school, like low amounts of sugar, low amounts of processed food, low carbohydrates, lots of vegetables. And you can do probiotics orally. You can even do probiotics rectally as an enema. That's one way of doing it. But one of the most impactful ways in changing a microbiome quickly would be using a fecal FMT, called it's basically a fecal transplant. Some of the herbs which we know helps with inflammation, such as berberine, has been found out that one reason, the mechanism why berberine is an anti-inflammatory and golden seal is an anti-inflammatory, is that it's changing the microbiome to decrease inflammation in the body. That's one of the mechanisms of how berberine is effective. And berberine and golden seal, I think, is a very effective tool in MS patients to help with the gut microbiome. So basically, a fecal transplant, you're taking the feces of a healthy donor, they process it somehow, take out the fiber, and basically just keep the bacteria. In one dose of a fecal transplant, there is over 10 trillion CFUs, actually 50 trillion CFUs per dose of over 1,000 microorganisms taken from a healthy person, versus a probiotic, which has about 50 billion CFUs per dose taken orally with 6 microorganisms. It's been traditionally used for Clostridium, and it's been helpful for Clostridium, but Daryl, can you? Gastroenterologists have been using fecal transplants, and it's approved therapy for Clostridium infections. Clostridium infections can cause neurotoxin and also cause constipation. So this is a case study where in 2011, a gastroenterologist was treating patients with fecal transplants for patients who had Clostridium and constipation. And you notice he had 3 patients who also had multiple sclerosis, and not only the bowel symptoms resolved, but also 2 of the patients no longer needed a urinary catheterization after the treatment was done. All three patients regained the ability to walk unassisted. It's amazing that just doing the fecal transplant was able to help these patients. I'm just going to stop using it because it doesn't work. So here's a case study of a patient who actually went to the same clinic I went to. Before he'd done the fecal transplant, he had needed a cane and a hard time walking, and within a month, this is what happened. So this person, the only thing he had done was a fecal transplant. Before that, he was walking with a cane. So in conclusion, one of the factors we have to look at is the microbiome. We have to, just as like organic gardeners have to look at different a healthy ecosystem, creating a healthy ecosystem in the gut is one thing which is absolutely essential for patients with multiple sclerosis. That's true for primary progressive and relapsing remitting. Actually, the doctor who recommended me this treatment has primary progressive, and he came out of a wheelchair. He did this as one of his therapies. So in a sick microbiome, there's going to be a leaky gut, there's going to be blood-brain permeability issues, neuroinflammation, and gut permeability. In a healthy microbiome, you're going to be producing lots of healthy neurotransmitters, which are going to be healthy for a patient. Acetylcholine, by the way, is essential for myelination. So in remyelination, cholinergic signal is important. And other ways of improving acetylcholine will be also taking phosphatidylcholine supplementation 1 gram a day. So these are all the factors of why you want a healthy microbiome. The other thing is GABA. When GABA in the body produces it, it inhibits glutamate. And glutamate is actually another mechanism that they're finding MS patients have. They used to think glutamate was just in Huntington's disease, but high amounts of glutamate are found in MS patients. So they're looking at drug models' way of increasing GABA. One way of increasing GABA is kava and theanine from green tea. Taking GABA orally usually does not work. So taking kava is another thing to think about just to help with a cholinergic signaling and decreasing the glutamate.